So we're going to use the blood pressure cuff to help us be more aware of what our core is doing while we're doing certain abdominal exercises. It's primarily very, very good for using it to train your transverse abdominals, also your lower abs. Bear in mind your lower abs attach from the rib to help you crunch that way, but they also, by touching the front of your pelvis, pull up to create a pelvic tilt, which is what you want to try and do. Right? And we all know the transverse abdominals can make you a nice flat tummy and give you good core stability. Okay? So what the first thing I do, I place the blood pressure cuff in the centre of the small of my back. I over-pressurise it. Okay, so I can feel the pressure in my back and adjust it until it's the centre of the small of my back. Once I'm happy there, I'll then pressurise it, or release pressure, we'll put too much in, so it stays at basically 40 on the dial, 40 on the dial. Okay, so now I'm nice and happy at 40. Now with my legs straight, right, if I've got tight hip flexors, they'll be pulling on my lower back, because obviously the hip flexors go from the inside of the femur through the pelvis and attach to the lower back. So if you've got quite tight hip flexors, it might be worth having a quick quad stretch and hip flexor stretch before you do this exercise. Also, in fact, a good hamstring stretch as well. So I'm staying here at 40, which I'm quite happy with. What I'm now going to do is place my hands on my lower tummy between my ribs here like so, and I'm going to suck my belly in. I'm going to try and create a hollow, so I get a nice flat bit here. Okay, I'm pulling my tummy in to get a good flat tummy. However, I'm trying to make sure as I do this, nothing else moves. If my back goes into the floor, you will see the pressure rise. If my back arches, you will see the pressure drop. So the idea is, I should be able to activate my TVA, suck my belly in, without anything else firing. So it should stay at 40. Okay, so I pull in for 10 seconds, then I release. Okay, so 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release. Alright? Now, if I can't do this and I pull my tummy in, everything's firing all over the place, it means I'm doing shotgun effect, all my muscles firing, or I'm just tensing my butt up, things like that. So I won't progress until I can master 5 lots of 10-second belly tucks, okay, without that moving. Once I'm confident that does it, what I then do, okay, is bear in mind, as I said before, the lower abs attach to the front of your pelvis. Now I sometimes stick my fingers in here so I can feel my abs move. So I'm going to suck my belly in, okay, hold it at 40, I'm nice and steady, then I'm engaging my lower tummy muscles, I'm going to pull up so I get a tilt to the rear, so my pelvis has a posterior tilt. That will push my back into the floor, and I'll do this until it reaches 70 on the dial, and I'm going to hold that for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, then I'm going to relax. So what should happen is, I suck my belly in, stay at 40, I tilt until it gets to 70, hold that for 10 seconds. When I release, I should in theory go back to 40. Now sometimes your back might adjust itself and relax a bit more, in which case, if you're doing it on your own, what I would do is close my eyes, take 2 or 3 nice deep breaths, open your eyes and check the dial. If the dial moves, I either pump it up or loosen it until it goes back to 40 again. I don't move my body, so I adjust the dial to me, not myself to the dial. Okay, and that means I get my natural curve. So once I've mastered that a few times, okay, I want to pull my tummy in, tilt 70, and again, I want to be able to do 5 lots of 10 seconds without my it flickering too much and vibrating too much. Okay, so I should be nice and steady at 70. Once I've mastered that, I then bend my knees. This will change my back position because I've eased off from my hip flexors now, so I'm going to have to readjust the dial. So here, I'm going to have to let some out. Now, very few clients actually don't have it need to adjust at all, but that's quite rare. So I'm back on 40 again, and I'm going for the same system. So what I'm going to do is suck my belly in first of all, hold it there for 10 seconds, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Okay, I'll do again, 5 lots of 10 seconds. I will not progress until I can do that with that being nice and steady at 40. Once I'm happy, again, I pull my tummy in, steady at 40, and do a tilt up to 70. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then relax back to 40. Good. Alright? And I must emphasize all the time, do not progress to the next level until you can master 5 lots of 10 seconds at that level. So if I can't hold steady at 40, 5 or 10 seconds, I don't progress. Once I can do that, I go for the tilt. Once I can hold that at 70 without too much wobbling, okay, then I can progress. So my next stage now is to use the weight of my leg to train my abs even more. So as I start to lift my leg up like so, my hip flexor, which is pulling my leg up, also will pull on my spine and try and get my spine to curve. By engaging my TVA and pulling up my lower abs to create a posterior tilt, I will counterbalance the weight of my legs on that side. Therefore, I will train my lower abdominals and TVA slightly harder. So again, the stage is suck my belly in, hold it at 40. When I'm happy at 40, I tilt to 70. Now, once I'm at 70, I slowly lift my leg up. So there, and then I slowly back to there, then I release. Now, while I was lifting my leg up and down, I made sure the dial stayed at 70. Okay, so you might have to gently release or gently control it so it stays at 70. When you first do that, especially when you do initial lift, you might find the dial jumps because it pulls on your spine. So you've got to understand that when I first do it, back there, I've got to pull a bit harder. When I get up to here, my leg is lighter, so I can ease off slightly. So when I lower, I slowly increase the pressure so it's nice and steady all the way down, then I can relax. Okay, I'll do 5 lots of 10 seconds. Once I've mastered that, suck the belly in, tilt up to 70 again, and I'll do it the other leg. And then I'll lower and I control. See, I'm putting my tummy in, keeping that 70, keep it 70, keep 70, then I can relax. Okay, so I need to do 5 lots of 10 seconds on each side. Once I've mastered that, I then lower my legs to the floor. Okay, readjust the dial because I have to, because my back is now more arched. So let's just pump that a bit more. Cool. Okay, again, suck my belly in, stay at 40, tilt to 70, now. Like so, staying at 70, bring it down, keep working it, keep working it, keep working it, keep pulling, keep pulling, keep pulling, keep pulling. Cool. 5 lots for 10 seconds. Okay, once I've done that, suck my belly in, tilt, and I'll do the same with this side. Ease off a bit more, and then slowly increase the pressure. Always keep putting my tummy in. And that's 5 lots to 70 on that side. Once I've mastered that, I can come back up to here, or I can stay down there, and even do the same thing, tilt up with a straight leg. Now, if you've got tight hamstrings, this will have an effect on your pulling your spine. So you've got to make sure you have a good stretch of your hamstrings. Okay, but initially, you won't get that many people doing that straight away. So that's one to go for in the future. The most important thing is to be able to pull your tummy in, steady at 40. You need to be able to then tilt, steady at 70 before you think of any other kind of leg movements. If you can't do those, there is no point in trying to progress. Okay, this will give you very good control and an awareness of what your abs are doing, TVA and your lower abs in particular, and actually help you very good in some of your core stability exercises. However, do not rush this. You must progress through each level, okay, until you've officially got that. Otherwise, you're basically making it harder for yourself. Okay, it's the old saying, you'll be cheating yourself. Okay, thanks very much.